I really enjoy helping all types of patients, from the most simple problems to the most complex. I find that any of those types of patients or types of problems are really satisfying to address, whether it's somebody that has a small disc herniation that's very easily removed and they have a very rapid and complete recovery, to somebody that has a multi-level degenerative condition that results in a spinal deformity that requires potentially a staged operation and is a much longer course of treatment. I think that there are nuances of all of those types of patients and operations that are quite satisfying, and really enjoy helping people all along that spectrum. I think one of the outstanding components of Carolina Neurosurgery is the breadth of services that are offered outside of surgical care. We have one of the leading physical therapy groups. We have a phenomenal group of physiatrists that do injections and non-operative therapy. And so I think for the majority of our patients that don't require or may never require any surgical intervention, we have a wide range of treatments available for those patients to also help improve their quality of life and level of function. During my first visit with a patient, I really try and gain an understanding of what's bothering them the most. Many patients have complicated scans with varying degrees of pathology, and I really look for that which is causing them the most trouble. In understanding what's bothering the patient the most, or which is impacting their life in the greatest way, I can look for the easiest, simplest, and least invasive solution to their problem. So I was first exposed to neurosurgery even before I went to medical school. I worked in a hospital for many years, starting when I was 16 years old, and I was really drawn to surgery from an early age. I loved the attention to detail and the hands-on nature of it. Before I went to medical school, I worked for several years outside of Boston at a hospital where I worked with the neurosurgery group and really fell in love with neurosurgery. And so I knew that I was interested in neurosurgery even before I went to medical school. I think the most enjoyable part of my job is actually seeing the patients that you help. I get a lot of satisfaction from helping people improve the quality of their lives and their level of function. I think that's incredibly satisfying. Sometimes these patients wake up immediately and say that's the first time, potentially in 5 years, that their leg hasn't hurt or that they feel like they've been able to walk normally. I think that's incredibly satisfying. And I really enjoy that role that I can play in someone's life.